Welcome everybody to the Healing Connections podcast. My name is Emmy Vadnais. I'm an occupational therapist and an integrative medicine practitioner. And today we're talking about a holistic approach to pain with Deborah Rogers. And the Healing Connections podcast is a time where we come together to talk about complementary and integrative medicine and healthcare. And I've had the pleasure of interviewing some really fabulous folks about different approaches to health, wellness, and prevention. And today we are fortunate to have Deborah Rogers speaking with us. Deborah is an occupational therapist and a Reiki master who practices integrative medicine for pain management, prompted by her own physical injuries and resulting chronic pain. She's worked in inpatient and outpatient settings, hospice, and designed and directed a program for people with mental illnesses where she organized and led classes in coping skills, cognitive behavioral skills, expressive therapy, and community reintegration. She now works at Holistic Therapies for Life with adults who experience an array of pain symptoms and injuries. So welcome, Deborah. Thanks for joining us.
Thank you, Emmy. I'm so glad to do this with you.
Yay, wonderful. So why don't we just go ahead and begin and share whatever you'd like to share about how you became interested in helping people with pain, which is such a big problem that so many people deal with.
I know, it's a huge topic now. I basically started just because when I had my injuries, I had to figure out how to cope with them and cope with the pain, because a lot of basically the medical system was focusing on the physical part of it. So I had to work through my own journey, and I put a workbook together of my strategies and techniques, and I hope to be able to help other people and also learn from them. And so they don't feel so alone in trying to figure it out.
Yeah, and would you be willing to share a little bit about your own experiences with injury, pain, or recovery that led you to this?
Yeah, trying to be short and brief, but it's hard because, so I had a herniated disc originally working as an occupational therapist, and the assistants actually were laid off, and I had a heavy patient caseload, so I herniated my disc. After that, I was given an epidural that instantly led to L5 nerve damage, foot drop, horrible pain. About 3 weeks later, another doctor intervened, and I had surgery, the L5S1 discectomy. But what happened is the epidural had splattered the disc, so they had to take out so much bone to get to all the fragments that on the recovery table, my back broke. And they didn't realize it at the time. They thought it was more a bad experience from the anesthesia. So I went home a few days later and basically was bedridden for a month in pain. What happened is the bone broke off, cut through the dural tube. I had spinal fluid leaking for a month. I had osteomyelitis in my spine. I had another staph infection. And nobody was believing me when I was telling them I had spinal fluid leakage. I kept going back and forth to the ER, and eventually I was finally admitted, and I had a second surgery to repair the dura. I was in the hospital for a month. I had to start learning to walk again because my nerves were damaged and also so inflamed that I couldn't walk. And that took a long time. And then I was still bedridden for quite a long time from pain. So they discovered that basically my spine had, I guess you could say, collapsed. Like my L5 was on my sacrum, like bone on bone. And that's what was causing the pain. So I was given a fusion, L5S1, and then I had the TLSO, or the brace that went from the clavicles to the sacrum. I couldn't do anything but lay down, so I had to go home. It was in California at that time. I had to go back to Massachusetts so my parents could take care of me. So I was there for nine months, I think. And then I went back to California and could finally start recovering. And I was diagnosed, I had lots of diagnoses, but now neuropathy is a diagnosis, adhesive achneitis is a diagnosis. So L3, the nerves L3 down are adhered in scar tissue to the dura, which I do the therapy for, because I can.
Can you, for those who are not in medical professionals, could you share some of these, like the dura, for example, what the dura is?
Oh, it's that sheath. There's a few layers of sheath, but this sheath that surrounds and protects the spinal cord. and so the nerves, it also protects the nerve, the spinal nerves, and the spinal fluid, the flows in up and down in that.
Yeah, it's part of the central nervous system, right?
Yeah.
It's the brain, and then it goes down into the spine,
Right.
which is, we have our vertebrae, the bones, you know, that people think as a spine. That's really part of our central nervous system that then brings out motor and sensory nerves, right? So how we can sense our environment and also move in the world.
Right.
Oh,
yeah, good explanation.
Well, try. Oh my goodness. Oh my goodness. So you were in Massachusetts, you were recovering, and so what did you find? I mean, that's really quite a story to begin with. A herniated disc, which a lot of people experience, and then to have foot drop. Would you mind sharing with folks what foot drop is?
So when the L5 nerve is injured, you literally cannot pick up your foot to walk. So you're kind of like dragging it and tripping on it. And you also have sensation changes as well. Mine was just, I just felt burning pain. But yeah, when I was before my surgery, they told me that I wasn't going to get it back. So basically I did a lot of just guided imagery, imagining that it was moving, trying to, keep those pathways connected still, and vibrant, and I kept moving it with my hand, and I think that helped a lot. Because
this was after you had the fusion and we're now in Massachusetts. You were using guided imagery, visualization.
After my second surgery, when I was in the hospital for the month, I basically started the guided imagery and trying to get my foot to start working.
And the doctors didn't think that you would get your mobility back?
No, I was told that I was supposed to go to a sniff. I was told I was never going to be able to walk normally again. I always have a cane or a walker.
To a nursing facility. Yeah.
Yep,
so basically a nursing home or transitional care rehab center. Yeah.
Right. And then I was told I'd never work again. I'd probably be relying on my parents. So basically that's all I had to hear. And I just said, no way. Wow. I'm going to figure this out.
And here you were an OT, right? So an occupational therapist. We work in rehab settings. That's one of the areas we work in. And so were you working were OTs and PTs coming in and working with you at the time?
I didn't actually need an OT. I was fortunate that my supervisor at the time brought all the supplies in. So I had a long-handled reacher. I had a sock aid to help me put in my sock because I couldn't bend down, a dressing stick to help me pull up my pants, and
all the classic OT adaptive equipment pieces.
Right. And I knew how to, log roll to my side and push myself up the right way. So I was very fortunate to be an OT in that aspect. And then I did have a PT come in who had to help me learn to walk. And help me learn to do like a set of stairs.
Okay.
Yeah, so I could get home.
So when you went back to Massachusetts, were you mostly in bed because of the pain, or were you also still limited physically with the nerve affecting mobility?
I think it was like all of the above.
Okay.
It was really excruciating pain, and then the brace alone, it's so funny. The brace alone, I could not breathe, which, people know when you have pain, you're already holding your breath, and it's so important to actually be taking deep, full breaths. And so my friend, who is also an OT, came over with a heat gun. People use heat guns to mold splints.
Oh, sure.
So we tried molding it when it worked.
Oh, I see. To make it more comfortable for you.
Yeah, exactly. But it was. I think it's just all the injuries that happened before, and the healing process. It just took a long time. The osteomyelitis took a huge toll on me in the sense that any movement, like a movement of my finger caused severe spasms throughout me.
Wow.
If I moved my head, I had severe spasms. So my body was so tight and rigid, and then there was all that nerve pain on top of it. And then I was put in a brace when my body was already so rigid, which made it more rigid. I had lost weight. I was 85 pounds, so I didn't have muscle anymore. And because of the brace, I lost that core strength. So I wasn't able to really hold myself up. So, yeah.
So you were in pain, and were you being managed by the medical team with certain pain medications, or what was being offered to you? And it sounds like you really took your own pain management into your own hands. Is that true?
Yeah. Honestly, I don't know what pain medicine I take, because I really tried getting off pain medicine because it fogged my brain so much that I really couldn't carry on a conversation.
Yes.
So I basically got off the medicine and I said, if I'm going to take control of my recovery, I need to be able to think and figure this out. So I did lots and lots of journaling, trying to develop more emotional awareness. What am I feeling? What emotions are under that? I did a lot of dialoguing with my body, trying to understand trying to reconnect with my body. I did, while I was home with my parents, that time period, what was really life altering is that my dad would take me to this woman, and she was a Zen monk, and she also was trained in John Kabat-Zinn's mindfulness body stress reduction program. So she taught me a lot about Buddhism and meditation, and we started off focusing on just going in and witnessing without judgment my emotions, my thoughts, and not even label them. Just say, okay, emotion, thought, that's it. And learn to kind of separate, detach from that. And then I learned that I was attached to my old body, my old life. So I needed to kind of step back from that. And
so you were dealing with grief and loss.
Yes, which I didn't even realize till a lot later. Yeah. Because I was still holding on.
I mean, of course, if you have, all that you've been through is grief and loss, but I think that it's something that's not often addressed in healthcare. And you and I have had conversations about that.
Yeah, we have, because I think it's a huge, huge issue. I wrote a blog on the Mighty, and a lot of people were saying, people aren't addressing grief because you lose your roles, you lose your identity, you're basically taken out of your body, put into this another body that you have, like being put into a foreign country. And you're like, okay, go figure it out. And how do you do that? You lose your sense of self, your identity. And a lot of it, I think, is really important that part of treatment really needs to incorporate how do we help this person reintegrate and develop a sense of self and self-compassion, self-love. Carl Jung would call it the synthesis of the self. And I think that's really, really important and a huge part of healing, because I'm not really focused on much of like, I have to accept the pain. I'm more focused on, I need to accept my body and myself, and then I can accept my life. Because when I had doctors tell me, you need to accept that you're going to be chronic pain forever.
Wow, they said that to you. There's a lot of power in words, right? And especially those in authority positions, particularly physicians.
Yeah. It feels devastating, and you feel like hopeless. But and I kept asking, like, who am I? How am I going to accept this? So how am I going to accept pain? And then I realized, wait a minute, I'm not going to be focusing on accepting pain, because I can't. And if I did, I still want to be looking for treatments and getting treatments that actually were helpful, such as like prolotherapy, which I can talk about later. But so I had to accept myself, and that's real, and embrace myself. And meditation was really the start of that. And the other thing about meditation is she taught me how to go into my body and watch pain, witness it with curiosity. Yeah. And which was so important, because right then I was beginning of me starting to not fear pain. And the fear of pain is so, so huge, because pain seems like this huge monster that is just taking over your life and your body. And it was fascinating. I started realizing that pain is always changing. And I realized even when I'm in flare-ups or the pain's excruciating, it's still changing. And so, and then I started working on breathing into the pain, or maybe sending colors to the pain, like imagining myself sending colors. And I realized, wait, that feels calmer. And so I realized, wait, I might have some control over this pain.
Ah.
And yeah, and then I went deeper.
Maybe one of the first times you maybe felt like you had control, because I know loss of control is another significant factor anytime, in your experience or those we serve as healthcare practitioners, and really when somebody has any type of change in their lives where they feel like it's an external versus something that they chose.
Right. And it's interesting because it's so important to get in touch with one's emotions, I feel like, especially fear. Fear is such a huge, devastating emotion. And when you're fearing pain, rejecting pain, your part of you is also rejecting your body and yourself. So when you're able to go into that and learn how to start feeling safe in your body, which is huge, it really can alter things. And you can start go deeper and deeper. And I realized that there's a part of us that is pain-free. It's like the essence of us. We're not, there's a part of us there's peace and there's not that pain. So what I realized is I can start finding this part of me where I also felt love. And that became my coping strategy, because I couldn't go running anymore, and I couldn't go outdoors and go for walks or hikes anymore. And that used to be my coping techniques, and I couldn't do that. So now I had a new coping technique. And
so your injury and experiences made you go deeper within yourself.
Yeah. I had to somehow, I guess what I did was I made this my purpose, to learn about pain. And through pain, I realized, wait a minute, I'm really my teacher, and I'm learning more about myself. Yeah. And it's fascinating because, they've done research. In 2014, Harvard researchers at Mass General studied people who were meditating 30 minutes a day for 30 days in a row. And they found out that the gray matter density increased.
Yes.
Which is huge, because this has to do with learning, memory, self-compassion, self-awareness, and a sense of well-being. And with people with pain, especially chronic long-term, the brain does change. And they've shown that the gray matter, there's loss of gray matter. So, but we can reverse things, we can change things. And so that's a huge plug for meditation.
Absolutely. Well, there's so much great neuroscience that's been coming in now for decades, really. I mean, I think a lot of us feel that it's just in the last few years, but, I'm a huge fan of Dr. Herb Benson, and he coined the term the relaxation response. And and that's something else that I have noticed as a practitioner with my own, we all experience stress, and I'm really have noticed how much that stress, anxiety and stress, can really impact our well-being, and also how it's related to pain as well, which I know that you and I've talked a bit about as well, that oftentimes if we can lower stress and actually get more in that relaxation response state, that pain can come down. Did you notice that, or have you noticed that to be true as well?
Oh, definitely. What happens is, so you have like an injury, okay? And it's, danger alert sent to the brain. The brain is looking, it's comparing to emotions, to thoughts, to past experiences, memories. And it compares and says, all right, this is either danger or not danger. When it compares to all of that. And it can send the signal back down. All right, danger, you're going to either increase the intensity of pain or turn on pain, or you can inhibit pain. So there's a direct connection. And, a lot of us feel that when we're stressed, our muscle tension increases. Emotions, pain, basically, I'm trying to think of, Dr. Mosley in a TED Talk, he says that any evidence of danger to the body will produce pain. And that, I believe, can be emotions too.
Absolutely.
Yeah. And there's people, I had a client the other day, because I know there's a lot of people who have abdominal pain, and there's no, there's no necessary reason why, that there's no cause. And the client described it perfectly. She said, all my stress is I hold in my abdomen. And I know there's a gut brain connection. And there was a Harvard Health Publishing article that talked about how 13 studies were reviewed, and they showed that people who had psychologically based approaches to treatment actually did better and had less digestive problems afterwards than the typical medical treatment. And that's really, really big. In Dr. Hanscom's book, Back in Control, he talks about the amygdala, which plays a role in feelings and emotions, and it plays a role in emotional modulation. And it appears to be involved in the enhancement as well as the reduction or inhibition of pain signals. And he gives a great example about this person who's a veteran who got injured and got shrapnel. I'm trying to remember the story. And so he ended up recovering and was out of pain. But a year later, all of a sudden he would have these horrible, horrible episodes of pain, and they couldn't figure out what was going on because there was no apparent tissue damage. And what they discovered is every time a helicopter flew by, it triggered something, because we have these pathways that have been set up, and it triggered an emotional response, which triggered
post-traumatic stress. Yeah.
So but
even though his physical injury had healed, mentally, emotionally, psychologically, cognitively, it was still affecting this person.
Right. It's almost like, the emotions also get stuck in us.
And I remember you had mentioned something about how the physical and emotional pathways in pain are related?
Yeah, they share the similar pathways.
Wow.
So, the pain there's a huge network, and it doesn't go to just one area, but I'm trying to find.
Oh, that's okay. If you could just go back for a moment. I mean, I think that's just great, just for us to recognize that that it's connected anyway. And you had mentioned several sort of approaches that you took to your recovery that you said that your dad helped you meet this person who taught you about mindfulness-based stress reduction and other visualization and imagery and meditation techniques that you used. Was there anything else that you found that helped you with lowering your pain? And did it then also help you, did the lowering the pain then help you to regain your motor abilities, your movement abilities? Or maybe it all happened sort of simultaneously.
Well, it's been 20 years of working on this, so it's trying to figure out which and which. But you know what? When I was learning to walk again, Feldenkrais was really, really impactful for me. Great. Because it was really focusing on small, minute movements and learning what that feels like. And a lot of times, people in pain, it doesn't feel safe in the body. We're outside of our body. And, even before my injuries, I used my body to do activities, but I never really thought about being in my body. So I really learned a lot about the awareness of my body, and even how a small movement could set off anxiety too. So I think Feldenkrais was really helpful, and
Wonderful. And for those listening who don't know how are you doing now today with your back and the foot and your mobility and walking?
I'm hanging in there. No, my foot is fine.
So all healed up, all recovered.
All recovered.
Good job, Deborah.
Thanks.
Yeah, that's huge.
Out of my body. Good job, body.
Good job, all of you. Yes.
And I still have pain, But, you know, with meditation, you know, I've learned how to have it separate than me. It's not my identity. It's kind of that other thing.
Uh-huh.
I try really hard to listen to my body and balance it.
Mm-hmm.
You know, I still go to therapies, but, you know, I work as an OT part-time. I have a daughter that I take care of, which is basically full-time.
Yeah.
So yeah, I can't run.
Mm.
I try to sometimes, but you know, I know that's going to lead to bad stuff.
And
But
it can be high impact, right, on the
yeah,
joints and on the
right.
back.
But I do yoga. You know,
Good.
I work out. I do light weights.
Nice. And that feels good to your body. And does that help with the pain reduction as well?
It does, but it's really interesting because, um, you know, we talk about how I really believe pain is trauma
Mm.
because I get in this, and I think a lot of people with pain or chronic illnesses can understand this. You get into this above this threshold and this fight or flight. Like, you know, when you injure your elbow, your funny bone, you're like, ow, and you're up here, fight, flight, or freeze. And then you wait till it calms down and you're like, okay.
Mm-hmm.
But when you're being inundated with this horrible alarm of pain that you just can't seem to shut off, you end up here, and it's really, really hard to come down, and the brain rewires and you basically get stuck up there. And so what I've learned, I'm really trying to focus on now is because I was doing weightlifting and I was doing yoga, and I'm really, really flexible from yoga, so I can really do some advanced yoga. But I would always have this my muscles would just be so painful. And I have all over body pain now just because my system is so hypersensitive. And, you know, nobody could figure out what was going on. So what I've been discovering is I'm kind of like laying back on what I do. I'm taking more breaks in between, more rest, because it's almost like I feel like it's putting me in that hyper vigilant or hyper aroused state. So it's such a hard balance. It's always learning and readjusting. Like, how do I balance my activities? How do I balance the intensity? And how do I give myself that rest? And especially when the world is just going so fast paced.
Yeah.
The best thing someone can do is like slow down. So really trying to do that and learn how to like really truly relax within myself and be
And do you
present.
find that is when your pain is less, is when you're more relaxed, or when do you find that it's most reduced for you?
Good question. Sometimes.
Or maybe it varies. And
It does. I think with the dural injury and the scar tissue, I really feel sometimes like things get twisted or I feel like yanking.
okay.
So I do have to go to therapy to help kind of elongate things and realign things. And then I work on, you know, giving myself that time to kind of readjust and heal from that too.
Well, good for you. And I know that you've taken your beautiful and also heart-wrenching experiences, and now you're helping others. And so what do you feel from an OT perspective is the best way to help people with pain reduction or pain management, or decrease their pain?
I feel like one of the most important things is being present with somebody and really listening with your heart, not just your head. I think a lot of people feel unheard, unvalidated, unsupported. So I think that's definitely one of the first things. I also think really trying to approach it with a collaborative approach. Like, we are a team, asking questions. What do you think is causing this? What do you think would be helpful? Let's come up with ideas together, because people feel such a loss of control. And it's very, very empowering to be a part of your own recovery instead of having people tell you. And it also turns off that defense. When people are telling you, people are going to be much more apt to be part of that, those strategies for recovery, rehab, if they feel like they're part of it. And I think the other thing, which I'd like to push, is I think the biopsychosocial model, the components are very, very important. And they have shown that working on the psychosocial components actually does decrease pain, make people also less susceptible to pain. But I'd like to go a step further and say work in the biopsychosocial-spiritual
Yeah,
component.
that's the mind body, or the mind body spirit connection, which really is all one and is not separate.
Right.
And we're now, a lot of us in healthcare, recognizing
Yeah.
how important it is for the whole person to truly be addressed. And I also really liked what you said about, and this is what we're taught, and we're both occupational therapists. We're taught this in OT school, and probably other healthcare professionals maybe as well, is that as OTs, our work is very client-centered, which means that it's up to the client for them to tell us what is it that they, or for us to help them discover what is it they would like to be able to do that they're not able to do. So that's where that occupations, what occupies their time,
Right.
activities of daily living, and helping them to be in that collaboration. I really like what you say, because they're going to be more engaged. And often, just like yourself and your healing journey that you're sharing with us so authentically, and we thank you for that, is that a lot of times people do know what might help them. And I really like what you say about the biopsychospiritual model, is that especially with emotions, having the person being able to identify what is bothering them, what does need attention, and then also helping a person to connect with their own inner wisdom and intuition through meditation, through guided imagery. I know the experiences I've had in guiding others with reducing pain, those have been very profound for helping people as well.
Yeah,
So,
I love guided imagery.
nice.
Yeah, because people feel like a deep loss of self-worth or self-blame. And there's so many other components to the emotion. So it's using those techniques like guided imagery where you can go deeper and deeper.
And also the other thing is that I used to rent an office at a grief center, is that we think of, we're taught to think at the date of injury, right? Like if somebody had a car accident or had a fall or something happened, but really the person is a whole cumulative experience up to that moment. So, it isn't just what's around that, it's the whole person. And I've learned through grief therapy that, and talking with a lot of grief counselors, that when somebody has a grief or a loss, that they bring all of their other griefs and grievances and losses with them, and they can become amplified, or the current experience can be more amplified based on a cumulative effect of what's happened in the past. So I really like what you're saying about, addressing the emotions and the spiritual component, because there's often more going on than just that date of occurrence. And that, we like to we've been taught to compartmentalize, and there's more going on with the person, as you're saying.
Yeah. And, when you're talking about the past experiences, I have met people who've had a history of sexual or physical abuse in the past. And they're presenting with some type of physical pain. And, I remember working on one woman, and, I was doing exercises, all the things that she wanted. And finally, it was like her body felt like a suit of armor. She was stuck in this protective state because of past experiences. And the pain seemed to be presenting because more like there's emotions that somehow were being triggered and brought up because there wasn't really an injury that had happened. So yeah, our past plays a huge part, plays a part of our belief systems, our attitudes.
Right. Or there wasn't a physical injury. There was certainly a mental, emotional, spiritual injury that probably happened repeatedly. And that's something that when, we talked about how there's shared pathways between emotional and physical pain, that having, which unfortunately a lot of us have experienced in our youth, just because this is sort of how I frame it, we're evolving consciousness as humans, that, there's the adverse childhood experiences, which, a certain number, if you're interested in what that is, you can Google it. There's even a simple little quiz that you can take that it's correlated with the higher number a person has had with adverse childhood experiences, that indicates how their mental and physical health will be going forward in life. And so it's definitely all very much connected. I just want to make sure that we get to a few more areas that we wanted to talk about. Was there anything more on this topic that you wanted to any
Nope, that's
more?
okay.
Okay, I just want to make sure we get to a few more of these areas here. So you were saying from an OT perspective, the best way to help people decrease pain is being present. Is there anything else you wanted to? I know you're working on a project where you're putting together a lot of great information. So I know there's a lot you can share, and we'll give your contact info at the end so that people, if you do want to get in touch with Deborah, you have a beautiful website, Deborah, and are a great resource for people who would like to get in touch with you and learn more from you about how they can either work with you or other resources that you can give them, because there's certainly a lot. But is there anything that you just want to share that's coming to mind before we move on to another question here?
Yeah, I'd like to talk about fatigue real quick.
Yes. So how do you feel that pain is related to fatigue, or fatigue is related to pain?
It's interesting. I told you how one of the first things I learned was when after my injury, the amount of like fatigue, it's just bone exhaustion. I was all of a sudden understanding a little more like what the people who had strokes that I worked with felt when they were always saying how tired they are.
Yeah.
Have you ever heard of the spoon theory?
Spoon theory?
Yeah.
I don't believe so.
So it's great. It's actually pretty well known among us chronic pain patients.
Okay.
And some of us call ourselves spoonies. But this woman, her name, you can Google it and you can find the full story. I think her name was Christina. But she wrote the spoon theory, or Christine, she wrote the spoon theory about how she was experiencing lupus, and she went out with a friend one day to either a cafe or restaurant, and her friend said, "What is it like to like have lupus, or what's that feel like?" And so what she did is she collected all the spoons she could find, and she found 12 spoons. And she said, "All right, here are your spoons. Now run down the list of tasks for today." And this is very OT related. And so she said, "Oh, I get out of bed, I eat, get dressed, and I'm going to go to work." And she said, "Okay, stop there. First of all, you're getting out of bed, you have to give me a spoon." So every spoon represented like the amount of energy.
Oh, right.
So, and I can definitely attest to getting out of bed, just the thought of having to like live that day with like trying to figure out, okay, how am I going to do this, and this with a limited energy and revving myself up? It takes a lot of energy. So then make your breakfast, that took a spoon away. Yeah. And then choosing clothes, that took a spoon away. And she said, I have to really think about what I'm going to wear, because if my hands are really hurting that day, I can't wear buttons or maybe zippers. If I'm cold or have a fever, I got to figure out what I'm going to wear. And I can attest to that because my back is so sensitive sometimes that I'm changing my pants 4 different times, trying to figure out what can I wear that feels comfortable. And if it's a good day, I can definitely wear jeans. I get all excited. And then, so before she even left to work, she had lost 6 spoons. And so then she said, "Well, you can borrow spoons from the next day, but you don't know how the next day is going to be. Yeah. So you might not want to do that. And some tasks are going to be taking 2 spoons away." So by the end of the day, when she got home from work, she was left with 1 spoon. So what do? Do you run an errand? Do you cook? Do you microwave something?
Right.
And so it gave such a great example of how there's this limited energy, and we really, really have to plan, because we're already exhausted. The body is just focused on healing, and that's exhausting. Yeah. And mentally focusing on that is exhausting. But she also mentioned, though, she appreciates things more. Like when she goes out with a friend, that's a huge thing. So it's a great story. It's a great
it's a great analogy, and I think it really illustrates how much exertion it takes to go through. As OTs, we break things down into activities and tasks of activities of daily living, and you're right, we only have so much energy, and also depending on how much rest we got or didn't got, how well we ate or didn't eat, what we drank or didn't drink, how much activity we've had or didn't have. And also, again, tying that back into that biopsychospiritual model, that grief, that is a very, physically feeling that tension and the body being in that survival mode. And then also having to adjust to this new way of being, and then trying to, recover and stay well as well. It takes a lot of energy. And that grief can be very fatiguing, and needing to adjust to something new is very fatiguing. So there's a lot of energy drains on the body. And I'm also an energy healer practitioner, and my mind thinks of the energy system and how, you know, for those who are interested, you know, and I know you're a Reiki practitioner, and really, you know, that's Japanese, right? Reiki's Japanese. It comes from, yeah. So really, it's all working with the human energy system. But if anybody's interested, you know, do check out resources for working with your own human energy system, your own aura, your chakras, your meridians. You might even find, you know, and by the way, I just want to say that our talk here is not meant to be medical advice and to talk with your primary healthcare practitioner, but it might be something you want to bring up to them to see if they feel that it could be beneficial, or if it's something to try. In fact, there's very few precautions for using acupuncture, but it is an invasive treatment, you know, with needles, but there's also acupressure, and then there's also non-touch, which Reiki does, or light touch, and also Qigong and other forms of energy healing. But that might be something that can also, do you think, could help people with their fatigue levels?
Yeah, definitely. I mean, you're right. A lot of fatigue is because we're storing all these emotions, and if we don't release them, it kind of eats up our energy. Yeah, it's exhausting when you're releasing them. Sometimes it feels like that, but then it feels better afterwards. Yeah.
Yeah, I like what you say about, because that holding, that tension,
right.
Is draining our energy, right? Is that holding?
Yeah.
And there are times where there is something that needs healing, and then sometimes it's just a pattern, and that by relaxing and opening that up, that can also help with the energy levels. I know we've touched on this a little bit, but how do you feel that pain is related to trauma, post-traumatic stress, or anxiety or panic attacks?
So I definitely believe in a lot of instances that pain is trauma. I believe that it needs to be talked about more, that medical procedures can cause PTSD. That happened to me. When I had my epidural, the doctor said there's too much pressure to even give the epidural, and asked the nurse to hold me down, which she did, and gave me the epidural, which caused the pain, you know, the foot drop and all that. You know, I have many instances of different medical procedures that it led to PTSD, flashbacks, that it took years and years for me to figure out how to get over. And I also think fear of pain can cause panic attacks, because that fear of feeling that you don't have control, pain can be unpredictable. The fear is huge.
Yeah, because you don't know what's going to happen moment to moment, right?
Exactly. And so I think it really needs to be talked about more.
Yeah, and that's why we're having this conversation, getting more awareness. And I love how you're, you know, really highlighting how it's all connected. And while yes, the, you know, healthcare, medical professions, we want to help people, and some of those procedures, you know, a lot of them can have a person, they truly are out of control, right? People get sedated, they're wheeled around, they're often, things happen so quickly that they might not fully understand a medication or multiple medications, or what kind of procedure, or really what the potential, you know, how long a recovery might be. I mean, I've worked with a lot of people I serve, AKA clients, patients, and I hear a lot of stories about that, where, you know, they have had a procedure and now they're in the recovery, but they were not informed at how much pain they might have, or how limited they might be, or how long. I mean, and to be fair, there certainly are practitioners who do share this information, but I'm stunned at how many people are not given that. And so that can, again, really, you know, create that sense of loss of control, which is very correlated with fear and anxiety as well.
Yeah. And, you know, we're all trying, like the practitioners, doctors, we're all trying to figure it out. It's such a multidimensional, complex.
And things are so fast. I mean, in healthcare, things are so fast, and there's so much information to be shared. And, you know, so we're all certainly doing the best. And even in some of the best situations, I mean, things just happen that the doctors and nurses and other practitioners didn't anticipate. And then, you know, I mean, like, look at what you shared with your experience. I mean, you had, really a domino effect of a lot of really unfortunate incidences occur. that just seemed to kind of lead it from bad to worse, you know, and then you had to, I hope you don't mind me saying that, but that's sort of what it seems like.
Yeah, it did.
And then, you know, to be able to, you had to, you know, really dig deep within yourself. So what have you found? Are there any tips that you can give to folks about helping with that fear of pain, or to help kind of really bring back, you know, wherever we can, that sense of control?
I think it's really learning about yourself. You know, and not identifying with pain. Like I started, you know, I hate the term, people call me a chronic pain patient. So I started separating myself from that. Or I stopped saying my pain and tried to start saying the pain, especially in the height of all the injury and trying to recover.
Right, because you're not the pain, you're Deborah.
Right, exactly.
So you don't, so you don't become identified with it and have it take you over.
Exactly, and because you know, and it's just like you're not your job. There's a separate part of you that, you know, you do your job, but that's not who you are. And for me, it was really helpful to find a purpose, and that purpose was learning about pain and about myself. And I think education's power, because, you know, if we can modulate, you know, we can learn to modulate or deal with our emotions and beliefs and change them, and decrease our stress level. That does change pain, and that can change pain. So helping people know that, you know, they can have some control over their pain. And
yeah, and there's research that does support that as well.
Yeah.
Yeah. I love what you said too about that you found purpose. And I know that that's a very, I mean, even Viktor Frankl, right? Going back to the Holocaust, and those who, you know, were in the position to be more in a survival place to begin with, that by finding more meaning and purpose in their life, they tended to survive, I believe. So that seemed, and I think that that's true for whether you're dealing, I mean, I think that this is just my thought. I think most people deal with some type of emotional, psychological, or physical pain. And I think that, you know, some of my takeaways from our talk here are being able to know yourself, being able to look at these parts of yourself. And, you know, mindfulness is incredibly popular right now, and it does come from the Buddhist meditation Vipassana, which means clear seeing. So it's being able to look at your inner and outer world from a place of non-judgment, with love, with compassion, with acceptance, which I have had a lot of conversations about this. Acceptance doesn't necessarily, like you were saying, mean that you have to accept the pain. For some people it is, but it could be accepting your reactions to the pain, or your thoughts about the pain, or your emotions about the pain.
Right.
Yeah.
And a lot of treatments with cognitive behavioral therapy, you know, looking at your thoughts, your reactions, seeing how you can change them. A lot of it is really about awareness, and awareness of how we perceive pain and our relationship with pain, how we interpret our experiences.
Yeah.
And, you know, it doesn't have to be this horrible, like if somebody told me I was going to have pain for 20 years, good grief. But it doesn't have to be this horrible experience, because I love myself and know more about myself now than I would have otherwise. And I give my body, myself, a lot of credit, because we've been through a lot together. But, you know, if I can do this, I can do anything. It gives you courage, and and I hope people can find that within themselves, because you can't, even if you can't come out of pain, you can decrease it somewhat, and you can come out the other end feeling empowered.
Yes.
And having a sense of well-being. So I really want to let people have some sense of hope, maybe not about being able to get rid of pain, but be able to control it somewhat. And,
or maybe having it lower or decrease or go away. I mean, it's possible.
I do believe in the healing process. I mean, I wasn't supposed to be where I am.
Oh my gosh, you've made incredible, you know, literal leaps and bounds in your recovery. And
yeah, and the body wants to heal. It's designed to heal. It's always trying to figure out how to. Right. So we have to give it the opportunity, and give ourselves loving kindness for all that we're trying to do.
Yeah, not just on the physical, our whole mind, body, spirit. Absolutely.
Yeah, exactly.
One other area that I think that for those who are dealing with chronic pain or even an acute pain situation from some type of injury or surgery recovery or something of that sort, or maybe you recently had a baby or had a cesarean, or who knows what it is you're going through. I know that pain medications are used regularly and can be very effective. And I know that there are some folks who deal with chronic pain who want to keep using their pain medications. And then of course there's some who want to decrease that. I was just wondering what your thoughts are about pain meds, kind of while we're dealing with this opioid epidemic and crisis.
Yeah, I think it's made it a tough situation for a lot of people. I know there's a lot of people who can't get pain medicine now, when I know it would really, and they know it would really help them. It reminds me of when my sister got in trouble, and my sister did something wrong and then I got in trouble for it.
Oh.
It almost feels like that. Like, because of it, so many people now are labeled as a potential addict or abuser. And it's kind of sad, because a lot of people, I think, are feeling embarrassed or ashamed to even ask for medicine. And on the other hand, what I feel is, my heart goes out to the people who are struggling with that balance of taking medicine. Because obviously something's missing in the system. They're relying on that to help them because they're not finding something else that can help them.
Right. And they want to feel better.
Right. And I think, pain medicine isn't a bad thing, because it can, I was talking to you earlier about how it could be a coping strategy, right? It can get people out of pain or less pain, or gosh, it could give them maybe a good night's sleep, or even half of a good night's sleep, which is huge and so important in healing, as well as trying to bring down that whole physiological, the whole, hyperarousal.
Yeah.
So, and you can't take away a coping strategy if before there's not another one in place, that is actually effective as well.
Yeah.
So we really need to put some better programs into place. And I know people are trying, and it's tough because pain's such a multidimensional issue, but it's too bad so many people are labeled now. And, I know when I have flare-ups, Valium is the only thing that can help me usually, but it's really hard for me to get Valium, because that has a stigma. Oh my goodness, like, you're going to be addicted. So now I ask, can I have Valium, 5 pills, please, just for the week to help me? But it was hard finding a doctor that would give me that. And I'm not somebody that, I'm the one that tried to get off pain medicine in the first place way back when. So, I'm not going to have a problem with it, but it's tough. And I think there needs to be a really good relationship between a doctor and the person who's experiencing pain, and how can we work with you being on pain medicine, what is effective for you, and what else can we do to help with developing coping strategies? What
else we can do? Because I think there are also a lot of people who, granted, I think there are some people where, and I think this is also part of our, sort of left over from our pill popping culture, let's get rid of this, let's make it quick. And I think that we're all learning, and that's part of why we're having this conversation. And I think why complementary and integrative medicine techniques have become more popular, is that we're all learning that doesn't always work. I mean, sometimes it can be, I have a headache, I'm going to take an ibuprofen. But, if the headache continues after weeks and weeks and months, there's something else that needs to be addressed. And so I like what you say about let's find some additional ways, and that's what we're talking about here today. And I think that a lot of people don't want to become addicts, and can be very scared. I know some people who've had procedures where they've declined certain pain medications, or I know people who've been in recovery where they don't take the pain medications afterward, because they know how quickly they can become addicted to it. They're very powerful drugs and medications, and unfortunately they've ended up on the streets where people are selling them illegally, to get a high, to feel, because they can, certain ones can have have that pleasure effect. But I like what you say about, finding additional methods. And one of my heroes is Ram Dass. He has a well-known book, Be Here Now, and he hung out with Timothy Leary. He was a Harvard professor, went to India. He had been using different, really psychedelics, which actually there's some more research on some of those now that can be helpful in certain situations for people. But he found that with marijuana and other drugs that there would be a high, but then a really low low. And he got really tired of the highs and the lows. And he found actually that yoga and meditation really helped him to be able to reach those states, but more naturally. And I know that it's kind of like, with meditation, with mindfulness, that's why, the mindfulness-based stress reduction program, I believe it's 8 weeks. Many doctors do prescribe that for people with chronic anxiety and pain. And there's a lot of people who do receive a lot of benefit from that, but you have to keep doing it. And it's like exercise. It's something that you need to do pretty much daily or several times throughout the week. The more that you do it, the more benefits that you're going to receive from that. So know that there are other options out there. And let's see, is there anything else that you want to share here, Deborah? We should probably wind down.
Yeah, I think we covered a lot.
We did. And I just want to say thank you so much for being so candid with your own personal story of your own injury and recovery, and sharing where you are in that. But I think you are providing a lot of hope and options for healing for others. And we thank you for that. So thank you for being on Healing Connections today. And if you do want to get in touch with Deborah, would you go ahead and share your website and your email, or how people can reach you or learn more about your practice, or how you might be able to help them?
Yep, so I have a fairly new website. It's comebackfrompain.com, and my email is debrogers, ROGRSOT@gmail.com. And yeah, I would love for people to connect. I'm always looking forward to talking with other people.
Wonderful. Well, thank you so much, Deborah. It's been wonderful, very enlightening. And I love this, a truly holistic approach to pain discussion that we've had today. Thank you
so much. Thank you.
Blessings, everybody. We'll see you next time on the Healing Connections. Bye for now.